Now, ambulance ramping is a problem across the country, but I don't think anyone has staked their reputation on it, quite like the South Australian Premier Peter Malinauskas, who said in 2022, before he was elected Premier, that he would fix the ramping crisis. That was a large part of Labor's campaign. They had signs everywhere, "We'll fix the ramping crisis." Well, they haven't fixed the ramping crisis. It hit a record high in July. And now the state government is trying to gag a senior doctor from speaking out about just how bad the crisis is. Megan Brooks left the Royal Adelaide Hospital in 2022 because she'd had enough of not being able to do her job properly. She wrote in a scathing resignation letter at the time. It read in part, quote, "The ED clinicians are horrified as I am by our daily inability to provide care to patients when they need it. It offends our very humanity and flies in the face of all that we are trained to do. What is not understood by those outside the ED is that we have looked every one of those patients in the eye and been forced to decide that another human being needs care before them." She was also highly critical of the financial practices of the hospital. And the state government knows that she will blow the whistle if she's given a chance. Now, she's been called up to give evidence in a coronial inquest into 3 people who died after being ramped. That includes a man who choked to death on his own vomit. Dr Brooks said that SA Health wouldn't let her reveal official information, quote unquote, which meant her evidence could breach the public sector code of ethics, which would put her at risk of being disciplined. So she said she wouldn't be giving any evidence unless she was compelled to do so by the coroner's court or she was granted immunity from punishment, and then the court gave her a certificate of privilege which would allow her to speak freely without fear of punishment. Well, the state government challenged that, and today in the Supreme Court the immunity certificate was overturned. So Dr Brooks has now been gagged from blowing the whistle in court on just how bad the ramping situation is. Dr Brooks just wants to do her job. She wants to stand up for patients and tell us what's really going on. But the government is too scared to let her do it. And I think that just about says it all.